So the initiative that we're talking about today is the Concurrent Specialized Youth Hub at Wyndham House. And it's a service that is designed to provide complex, capable care to young people up to the age of 25 who require supports around mental health and substance use. So lots of services that exist for folks with mental health and substance use concerns are sort of either mental health or perhaps substance use, or perhaps, addressing a different concern, and like a physiological concern. And so the purpose of this service is to kind of bring everything together in one location. And it's the same location where our agency provides basic needs supports, connections to financial services, funding, housing searches, case management, and support of that nature as well. Many services may require that somebody is needing to be ready or decide to completely stop using substances in order to get the support around mental health or substance use. But we take a different approach. So the focus is really, regardless of where someone is at with their substance use, they're able to access the service and get mental health support, perhaps harm reduction supplies, perhaps harm reduction conversations, psychiatric support, and none of it is sort of conditional in that way on changing substance use patterns. And so that's really helpful for folks that are not really ready to perhaps go to an inpatient treatment program or a place where abstinence is the focus. Reason that it's connected to homelessness prevention is that we were seeing a great deal of young people in our shelter and in our housing programs and through our diversion program that had co-occurring mental health and substance use concerns. And we were trying to find a way to kind of meet those needs alongside finding appropriate housing supports. What we were finding is that it was pretty hard to access for a lot of the folks that we were supporting. And so the idea now is that when someone comes to our doors, we can sort of look at those basic needs supports alongside some of those mental health and substance use needs at the same time, so that if we're helping someone, for example, find a safe place to live, maybe they're looking for an apartment on their own, we're also able to provide harm reduction supplies and look at any maybe medication needs, any primary care needs, activity of daily living needs, all at the same time, so that it's set up in a way that allows that person to access all the supports they need. I would say that it started with just looking at data. So we're part of our community's by name list, and we collect data about youth homelessness, and we contribute to a youth-specific by name list in our community. And we meet monthly with our service manager, reviewing that data. And we always look at trends. What subpopulations are we seeing in the data? What kinds of trends are we seeing in our shelter program or our housing programs? And what we were seeing is that there was this trend, as I mentioned, with young people with co-occurring mental health and substance use concerns in the data, where it was harder to find interventions for them that were timely, that would allow them to access housing and homelessness supports and the health supports that they needed in a timely manner that would meet sort of all of their needs together. And so through that process, we kind of determined that we needed to look at options in our community that could address those mental health and substance needs at the same time as providing housing supports. So we were kind of looking at data, and we were seeing this trend, and at the same time other people were observing trends, but from a different perspective. So our local child adolescent inpatient unit, which is actually in the KW region, but it has a catchment of Guelph and Kitchener-Waterloo, was seeing an increase in the number of patients with, again, presentations around mental health and substance use concurrently. And they were seeing that specifically from the Guelph region, that there was more and more people ending up in a crisis inpatient unit because of the lack of supports, sort of community-based supports around that. And then our local Canadian Mental Health Association was also sort of seeing this trend around increased substance use in adolescents in our community, lack of supports. So we all came together under our local drug strategy, and we created a youth concurrent disorders working group. And we looked at all the data that we all had together in terms of the number of young people experiencing these concerns, what did it look like, what kind of service would be appropriate for them. And that we together, we developed the concept for the hub. And then we worked together to partner to apply for a grant for the hub and to start up the service as quickly as we possibly could. And we started it with a small pilot, just one clinician, and then it's grown to a pretty big team of support providers. So this work wouldn't have happened without significant partnership and collaboration. We needed to work with our local service manager to continue to look at data trends and understand what was happening for our homelessness population. We needed to work with providers in the community that do healthcare and harm reduction. All of those members were contributed to looking at the problem, conducting a gap analysis, and then actually coming together to develop a solution, collectively applying for a grant. And now in the provision of services, there are a number of agencies that are directly involved in that service provision. So while it happens under the roof of Wyndham House, there are workers that are coming from CMHA as part of that, from our local health center, partnering with public health around the harm reduction supplies that we provide. And so it is absolutely a collaborative effort. And I think that if there wasn't that level of collaboration, we may not have hit the mark on what exactly was needed in terms of the population, because we all have such different vantage points. And I think in homelessness, we often see kind of the failure situations where people are not getting their needs met. And it was important to work with partners to look at what services actually were available and how we could tailor them to the needs of this population. So first of all, I would say that since we went down the road of prevention, so not just what I've talked about today in terms of the Concurrent Hub, but also shelter transformation and introducing a rapid rehousing and diversion worker, we have seen a 92% reduction in youth homelessness in our community. So the first thing that I would say is that prevention is incredibly effective. In terms of key learnings, I would say that it is certainly like a change management issue. It's very difficult for, I think, the paradigm shift for everyone to understand why kind of we're shifting away from just looking at the moment in time and the needs in the moment to thinking about the big picture and what else could be possible for that young person. And certainly we've had to work closely with our partners, not just the ones I mentioned, but also referral sources in the community to understand why we take much more of a prevention focus now in terms of our shelter services than we used to. Because again, it can kind of seem as if perhaps it's almost as if we're kind of making it more difficult to access a shelter service. But really it's taking those steps to understand if there's another option for people, knowing that when people come into a shelter, they come into homelessness, they're experiencing far more risk situations, far more trauma, and lots of threats to social determinants of health. So that's been a lot of sort of change management work, and a key learning for us is just because we understand it from our homelessness perspective doesn't mean necessarily that our partners would understand that right away. And so what we did is we worked with the University of Guelph here to create an infographic video, one pager, and a number of other resources, and even diversion resources that our partners could use to help everyone understand kind of where we're coming from and what we were trying to achieve, and to participate in that overall goal of prevention work as a community. And then I think the other key learning is around the complexity of some of the situations that we've encountered. I think, you know, talking to partners and talking to other communities, this is kind of coming up across the board, is when you do diversion interventions or prevention interventions, it's important to recognize that there could be a number of unmet needs for the family or the individual that we're serving. And so although our primary goal or our focus as a housing service agency might be to focus on that housing piece, we need to make sure we're looking at the whole person and what they might need in order to experience safety, experience stability in the place that they are choosing to go. So that's another important thing to consider, and that's why we developed the hub service as well. Okay, so we work with a young person that we've worked with for a few years, and when they first came to us, they were a trans woman that was experiencing human trafficking. They were in a very dangerous risk situation with a partner, and they were only 17 years old. So it was very difficult for them to find somewhere to go, and they couldn't go home for various reasons. And so they came to us with requests around kind of housing and basic needs support. But this person was also experiencing struggles around mental health and opioid use, which we see very commonly related sometimes in situations of human trafficking. And so the young person was hoping to find a place to live, but also wanted support around mental health and substance use. And they had kind of gone to lots of doors and felt like they were getting perhaps pieces of needs met, perhaps experiencing some discrimination along the way, and not really finding a good place to land in terms of support. So through the Hub program and our diversion service, we were able to help that young person find a housing placement that was suitable for them. It was like an apartment in an apartment building, and also look at getting some support around mental health. So they were able to see our psychiatrist, and then some support around harm reduction supplies. They were able to see our addiction medicine specialist around addressing some opioid replacement options for them. And also through our primary care service, they were able to access supports around transitioning, because they hadn't been able to see a specialist around that and get some of the medications and resources they needed around that. So able to address all of those pieces together without the person having to go to 10 different settings kind of to get those needs met. And my hope and my understanding from the person is that they felt that this was an environment that they felt safe and not discriminated against. And so that was really important as well. They're actually able to then go to an inpatient treatment program that specializes in human trafficking. And so they went to that for a few months. Their apartment was available to them when they came back. They came back into our service upon their return. And then they were able to, experience more sobriety and think about next steps for themselves. So they were able to go back to school. And they actually also joined our youth advisory committee. So we have a committee that meets monthly to provide advice around the service that we're providing and to look at different policies and processes and make sure it continues to remain low barrier and addressing the needs of the population. And so now they're playing quite a big leadership role in that advisory committee and able to participate in that way, because they're experiencing a great deal of safety and security in their lives that they haven't experienced historically. So that's one story that stands out for me for sure.